Hello, I'm Jane Hinson. I'm the Iredell County Health Director. I want to talk to you a little bit about the work that we're doing related to COVID-19. I want to remind you what public health does. Frequently, we work quietly, very humbly behind the scenes, but you have safe drinking water. The food that you eat is safe. We're in schools, we're in childcare, even public swimming pools, tattoo parlors. We make sure your septic systems are safe, and we provide family planning, maternity, child health, immunization, and preparedness services and case management. Public health is the reason we don't have smallpox outbreaks, polio, typhoid, cholera. All of those have been eradicated through the work of public health. The only reason we have public health in our country today is to protect your health. We need you to trust us and know that there's no hidden agendas. When we give you guidance, it's guidance that's been tested through research, and it's the best knowledge we have at the time. One of the things that I thought we could do today that would be interesting is to separate fact from fiction. Just like you, I continue to hear rumors, and I continue to hear people say things like, this isn't real, this is made up. So I wanted to talk about that a little bit, and I wanted to make sure you understand that what I'm telling you is coming from the Centers for Disease Control or the Department of Health and Human Services. I've heard, this isn't real. These cases, they're not real, they're made up. We're lying to you. We're lying to the citizens. I can assure you that every positive case that we get, we have lab results that confirm that positive case. Every death that we notify you about on our website, we have a death certificate that confirms that death. This is real. This is not made up. Cloth face coverings. They don't help. It's ridiculous. I'm not going to wear them. We do have data, and we have research that shows wearing a cloth face covering can reduce the risk of transmission from you to someone else 50 to 66%. And you know, just talking, singing, yelling, sneezing, coughing can get the virus in the air, and you can spread that virus to someone else. So cloth face coverings do work. I'm young. I don't have anything to worry about. I don't care about this virus. What we know is that 51% of North Carolinians are at high risk for severe disease from COVID-19. They're at high risk either because of their age or because they have an underlying health condition. Even obesity can put us at higher risk for severe disease from COVID-19. And you also know that you don't even have to have symptoms to spread the virus to other people. So it is dangerous to believe that you shouldn't be worried about this virus. We've even heard stories, I want to get infected, I want to get it over with. We've heard of COVID-19 parties across the country. That is so very dangerous. That is dangerous to you, it is dangerous to your health, and it's dangerous to the health of others. What we also know now is there's very little long-term immunity. At least the research so far shows that even if you were to get infected, it doesn't mean that 6 months down the road you would be immune if you would get exposed again. Our latest guidance is if you are infected and you're exposed greater than 3 months later, we go through the entire quarantine period again. Another fiction is, I'm okay if I'm just around my family or my friends. I'm not going to get infected. I'm not going to wear my cloth face covering. I don't need to do that. I know them. I know that they wouldn't make me sick. Well, guess what? After July 4th, we've had many family picnics that have resulted in exposure and infection. We've had families rent beach houses together, and 20 family members are there, and you get back home, a few days later, you get the call. I'm infected with COVID-19. And then everyone that was exposed to that person needs to be quarantined for 14 days. So unless they are members of your immediate family in your home, you need to wear your cloth face covering. Just recently, the health director in Catawba County did a study. There was a small family gathering there, and within 16 days, 41 members of that community was infected because of a small family gathering. What happened is, as it was spread, individuals went to work. They had boyfriends, they had girlfriends, they went to visit friends, and that's how quickly it spread and how fast it spread. I've also heard we really don't have community transmission. I don't see people sick. It's not happening in Iredell County. Yes, it is. On June the 30th, we had 778 cases. Yesterday, we had 1,436. By the end of July, we will have doubled our number of cases. What saddens me most of all is to know that in our first 3.5 months of managing this pandemic of COVID-19, we only had 9 deaths. In the last 3 weeks, we have had 8 deaths for a total of 17. And we know that those individuals typically are hospitalized, sometimes for several weeks, and then the virus wins. What a horrible, horrible situation for that person to suffer and for that family to suffer. So yes, this is absolutely real. We also know that between 9 to 11% of all the tests that are done in Iredell County end up being positive tests. What that means to us is that's significant community transmission. So it is here in Iredell County. We've had outbreaks in nursing homes, residential care facilities. We've had clusters in churches, in a school, in businesses, in childcare. So yes, it is here in Iredell County. I want to end by reminding you that COVID-19 is not political. It's not about being a Democrat. It's not about being a Republican. It's not about our governor. It's not about our president. And COVID-19 doesn't care about elections. COVID-19 doesn't discriminate. It doesn't matter how much money you have or where you live. COVID-19 can find you. We have 3 and only 3 best recommendations. One is your cloth face covering. Anytime you're away from home and you have the potential of being exposed to someone else 6 feet or closer, you need to wear your cloth face covering. This is to protect other people. Even if you're not worried about what's going to happen to you, do this for your fellow mankind. Please, please do this. And social distancing, 6 feet away. Make sure if you're at the grocery store, you follow the lines going down the aisle. You stand where places are marked so you're not on top of someone else. And hand washing. We know that hand washing reduces the risk of transmission 20%. So if you add all 3 together, your cloth face covering, your hand washing, and your social distancing, that is the best that we can do, and that is your lowest risk of transmission or even getting infected with the virus that causes COVID-19 disease. I want to ask you again, please trust us in public health. When we tell you these are the best things that you need to do, please listen. There's no hidden agendas. We only do the work that we do because we care about you. And I don't want to see any more deaths in Iredell County, and it saddens me to see how quickly this virus is spreading. So if you have any questions, please let us know. Call us at the health department. We're here to help you. Thank you.